It is absolutely driving me crazy that oncologists right now, or at least in the state of Utah where I practice, are on this like anti-IVC campaign when there's so much good research on high-dose IV vitamin C being so good with chemotherapy. I'm Dr. Jake. I'm a naturopathic medical doctor and integrative physician. And on this channel, I share with you how you can heal your bodies down to the root causes without any harmful drugs or surgeries. Make sure to subscribe for more videos like this one. Okay, let's jump in. What are the benefits of chemotherapy in the first place, right? Is chemotherapy all wrong? Is it going to not be good for cancer? It's going to destroy your body? Possibly yes or no. So chemotherapy does have some good research on it on killing cancer cells. It depends on what stage you're on, what type of cancer you have, if it's warranted or not, right? But in certain cancers, it's very warranted. It has like a 95% success rate. So it's something that we want to do. But if it's a stage 4 cancer patient and it's like, okay, it's only like possibly 10% effective, if that, and it's causing a lot of harm, maybe it's not the right thing to do. But in general, chemotherapy can be a good option. And it's not something that you don't absolutely have to do and because you think there's going to be a lot of side effects to it. Now, if you do chemotherapy all by itself, it does have side effects to it. It does have weight loss, losing of your hair, fatigue, chemo brain. It has mucositis, inflammation of your entire gut, nausea, vomiting, possible cardiovascular effects, kidney diseases, neuropathies, neurological problems. There's a lot of issues that could go along with various chemotherapeutics, though. But what we have seen is there's a lot of natural things that you could take, like certain nutrients and herbs and other procedures that we could do to actually decrease the side effect of the chemotherapy and at the same time improve its effectiveness. And one of the therapies that we have is a high dose IV vitamin C to actually do that. So let's dive into like what's so great about vitamin C, right? One thing is it helps decrease the side effect profile, increase the effectiveness of chemotherapy. And what we're seeing in the research that it doesn't actually interfere with chemotherapy. Even though a lot of oncologists might say that it does interfere because they're not really looking into the research on it. They think theoretically, oh, vitamin C is an antioxidant. These chemotherapeutic drugs that we're doing are pro-oxidant. So they're going to interfere. But they're not looking actually at research. They're just theoretically coming with that. And they're actually going as far as telling their patients not to do it, even though they have no good evidence behind it. And they're saying, oh, there's no good research on it or whatever like that. But they're lying because there is a lot of good research. You just haven't looked into it. So there's that. High dose IV vitamin C has another additional benefit is it's going to boost your immunological function. So it's going to make your immune system stronger to be able to fight off the cancer. If the one reason you have cancer in the first place when you do have cancer is that your immune system isn't working right. So you might even have a good amount of white blood cells being made. Maybe your level on your blood work is like at a 7, which is great, but your immune system actually isn't working well. So you have a lot of the army, but they don't have a lot of good guns to be able to fight off the cancer. So vitamin C helps you give the guns and the tanks to be able to fight off the cancer better. But also even the best thing of high dose IV vitamin C is that it's directly cytotoxic to the cancer cell, meaning it kills the cancer cell, but it doesn't harm your own cells at all. The reason why is cancer cells and normal cells are totally different metabolically in how they work. So a cancer cell is anaerobic and a normal cell is aerobic. So what does that mean? An anaerobic cell only goes through one process of making energy production and only gets it from sugar. And it makes a glucose molecule into pyruvate and then it's shuttled out to lactic acid. That's the only way it makes energy production. But a normal cell, it uses sugar, protein, fat, and goes and uses oxygen for production of energy. So with high dose IV vitamin C, also what happens is it acts like a Trojan horse. So the cancer cell sees the vitamin C, it looks like a sugar molecule because it looks a lot like it structurally. The cancer cell brings it in, and then the vitamin C gets broken down into something called hydrogen peroxide. And the cancer cell can't break down the hydrogen peroxide. So the hydrogen peroxide damages the cancer cell and it undergoes a process called apoptosis, which is cell death of the cancer cell. Normal cell takes in the vitamin C. Vitamin C breaks down into hydrogen peroxide, but it gets broken down into water. So it causes no harm to the normal cell. So it's very safe for your own body. It actually makes your immune system work better, but then we're killing cancer cells directly. And then we're getting that side benefit of actually making the chemotherapy work even better and decreasing the side effects. So it's an awesome therapy that we do in integrative oncology. So what are the specific side effects that we are seeing? It's various. So it decreases the fatigue, I have a research article actually right here. It's in Frontier Oncology, the magazine, and it's called The Effect of Intravenous Vitamin C on Cancer and Chemotherapy Related Fatigue and Quality of Life. So in this research article, they actually looked into various research articles and saw how the quality of life was actually being improved. So, and specifically the chemo fatigue and the brain fog that comes along with this. So patients get these peripheral neuropathies, especially from cisplatins like carboplatin, and it helps decrease that peripheral neuropathy that comes with that. It also helps decrease the mucositis, helps decrease heart damage from like doxorubicin. So it helps with all kinds of different side effects that come along with the chemotherapeutics. And it doesn't make it not work. It's like, oh yeah, it helps with the chemotherapy because it makes it not work. No, it's not. It's helping it work better, but it's decreasing the side effects that come along with the chemotherapeutic agent. So let's talk about like when you want to do IV vitamin C with cancer. So you want to at least separate it by at least 2 hours. That means you're done with the IV vitamin C at least 2 hours before you do chemotherapy. In my office, typically what we're doing is we're doing it the day before a chemotherapeutic session, and then we're trying to do it as close to after the chemotherapy as possible. And that's usually the day after if they feel up to it, or the day after that. The ideal is the day before and the day after of doing high dose IV vitamin C. That's when we're going to have the greatest benefits of decreasing that side effect profile and improving the effectiveness of that chemotherapeutic agent. I recommend it all the time for my patients doing chemo. So most patients are on a 3-week schedule with chemotherapy. Some patients are on a weekly schedule, but majority are on that 3-week schedule. And most people, it's a day or two that you're in the chemotherapies. But yeah, you want to do high dose vitamin C, not only around the chemotherapy. Now you do want to do it the day before. That's very important, but you want to be doing it twice a week in between the sessions too, to get the best benefits. And usually we're doing at least 15 sessions of high dose IV vitamin C and minimum, but many times we're doing even more. And I like to do it the full duration of the chemotherapy sessions. What's the best way? Is it to orally, IV, or is it all the same? So the best way, if you're actually going to want to treat cancer actively, is you need to do IV. And you need to get the right dose of IVC. Okay. You need to at least get 25 to 100 to 125 grams of IVC in each infusion. You would never achieve that orally. And we've never seen in the research, even if you did achieve that many grams of vitamin C orally, which is crazy, you get really crazy explosive diarrhea, but I know some people could take it better than others. We haven't seen in the research that that actually absorbs appropriately to get the ascorbic acid levels that we want. So we like to get the ascorbic acid levels of like 345 or higher is where we want it. And that's what we're seeing in the research to actually have anti-cancer effect. We're not having as good of anti-cancer effect if it's below that. And you're not going to be getting that with oral vitamin C. You're only going to get that with IV vitamin C. And this is something that a lot of oncologists don't understand. And I like to talk to my patients a lot, especially recently. There's like this campaign against IV vitamin C. I don't know if a lot more people are doing it now. And oncologists are like, whoa, this is a competition with us and we need to start talking about this. But a lot of oncologists are telling my patients, you do not want to do IV vitamin C because it's going to interfere with the chemotherapy or it's going to be bad for you and it's going to harm you. And I'm just like, why are these oncologists saying that? Because the research doesn't back it. And I tell my patients, I'm like, okay, if they're saying that, please ask them to share a study with it. And I'm happy to share a lot of research behind why I'm prescribing IV vitamin C and how it does well with chemotherapy. So let's dive into just one right here. I recently had a patient come into me and their doctor was telling them that they needed to not do IV vitamin C with their chemotherapy, and specifically, they said that it interfered with paclitaxel. And I'm like, what does he talk about? We have a lot of research about actually IV vitamin C doing well with paclitaxel, which is a Taxol. And here's a study that I just barely looked up that I sent to the oncologist and my patient. And it's in the National Library of Medicine. It's in the journal Science Translational Medicine. And it's labeled high dose parenteral ascorbate, enhanced chemosensitivity of ovarian cancer and reduced toxicity of chemotherapy. That was in 2014. So why is the oncologist telling my patient that you can't do it with carboplatin and paclitaxel? And in the study specifically, it studied that specific procedure because it's a very common chemotherapeutic regimen is you do carboplatin and paclitaxel together. So, in the research that's on this is like, okay, we're going to do high dose vitamin C with these chemotherapeutic agents, and what's going to happen? And they saw that they're actually made the chemo work better, like we're talking about, and it decreased the side effects of the chemotherapeutic agent. So it is absolutely driving me crazy that oncologists right now, or at least in the state of Utah where I practice, are on this like anti-IVC campaign when there's so much good research on high dose IV vitamin C being so good with chemotherapy. So I don't know where they're coming from. And that's where most of our research even comes from, is IVC with chemotherapy, because that actually, we just piggyback IVC with the millions of dollars of research that's being done for chemotherapy. So we have so much more research on IVC with chemo than doing it alone. So that's just my little rant on IVC and chemo. And there's so much good research out there on IVC. It's not like just me as a clinical physician and I'm seeing good results personally myself, and I'm seeing other doctors around the country doing it. We actually have white papers telling us that IV vitamin C is great with these therapeutics. So I really wish that oncologists would stop doing this propaganda of false lies about IV vitamin C and limiting their patients from getting such a great therapy. So yeah, if you're interested, actually going to an expert in IV vitamin C and listening to someone that actually knows about the alternative therapeutics. So I just want to go on a little side tangent here. Is oncologists know what they know. They know chemotherapy, they know radiation, they know certain immunologics, but they are not experts in all oncological treatments. So if you're looking for like alternative therapeutics and know what the research is and want to go to an expert that actually knows how it interferes or interacts with chemotherapy or other medications that are being prescribed by the oncologist, you need to go to an integrative oncologist or naturopathic oncologist that knows what they're talking about. Because your oncologist, 99.9% of them are not knowledgeable about it and haven't done the research on it. So if you're interested in go to an integrative oncologist like me, visit my website, integrativemedica.com, find the phone number there, call my receptionist, set up an appointment with me, and we're able to talk about all the things that we need to do regarding oncology, with chemo, without chemo, whatever. You can also set up an appointment directly from our website. So if you want to learn more about vitamin C and other oncology treatments, click my videos to the right. I'm Dr. Jake, and I'll see you there.